It's actually a checklist for you to see if you might be vulnerable to have a major cardiac event during the race. So if you experience those symptoms or conditions, then you may have to seek medical advice before you start the trail. So for example, some people, when you do exercise, you start to feel chest tightness or chest pain easily, or when you feel exhausted, you may faint, or you had some episodes of near fainting during the practice, then you may need to see a doctor before you come to us. And then some people, for the number 3, excessive breathlessness, it means that you may have been training for a long time, and then for the last few times you feel your condition gets much worse than before, then you may have to get to a doctor, because condition changes during your training and there may be some hidden problems you may not have exposed before. You have to seek a medical advice first. And then if you have a past medical problems related to a heart, you may have an abnormal heart sounds or murmur, then you should seek medical help before. If there is any family history of premature death, which is defined by before the age of 50 in your family due to heart illness or some heart disease that may be inheritable, then you probably need to seek medical advice before, maybe even before you start training. Personally, if you have a history of a significant heart disease, stroke, or a peripheral artery disease, or you have a major risk factor for these illnesses, for example, diabetes, you're smoking, you have hypertension, or you have a high lipid level, then it is advisable for you to treat them before you start the training. And this is a loose, probably loose guideline, because many trail walkers are aged about 45 in men and 55 in women. But these are just a risk factor for significant heart disease or stroke. And another thing is some quick tips during the race you have to be aware of. Common medical problems we see in the medical tents include blisters. In general, if the blister is small and they don't really cause you too much pain, then you may probably just leave it intact. If it's really big or is so painful when you walk, you're barely able to take the stairs, then you can come to the medical tent. We can help you to drain it. So we'll drain the fluid out, and we'll give you a dressing to press on it to prevent it from recurring. Taping is a very good way to help with prevention of the injury, but sometimes the taping can cause blisters as well. And some people may be allergic to some taping, so be sure to try it before your actual race. If you're allergic to it, then you may have to change another material. And this is kind of a bleeding under the nails. I believe you might have experienced it before. It's so very painful. So to prevent it from occurring, try to wear a properly fit shoes. If it's too tight, your toe keep crushing on your shoes, and it will happen when you go downstairs and also downhill. And knee pain, I think Willis has mentioned a whole lot of it. So we can give you some oral analgesics like Panadol, and we can also give you some analgesic balm, which is some cream to help with the pain, but it's not really treating the problem. It's just help you carry on. You can have some treatment during the race if you have IDPS, but if it's really bad and still early stage, you may have to quit. And we can give you some ice for the pain, but it's not really helpful. When you're walking during the race, the ice doesn't help. And exhaustion is one of the very common things we see during the race. It's better to time your pace adequately without pushing too hard. The weather change is significant, and especially when Hong Kong is very humid and very hot, so be prepared. Muscle cramp is a very common thing in general. You overtrain your muscle, you overuse it, you have it. But the real cause of muscle cramp is not very well understood. In general, in terms of sports science, they don't recommend taking pure salt tablets because it's not supported by evidence that it can help. But drinking electrolyte drinks might help a little bit. But so just massage and prepare well before the race can help. And make sure to rehydrate your body adequately. And if you have muscle cramp, just stretch it. It's not very common to have fainting during the race, but it's common at the end of it because some people would take alcohol at the end station. But then at that stage, because your body right dehydrated, and the surge of the alcohol would cause vasodilatation, so your body gets red, and the blood drains to the surface, and your body lacks blood, and you faint. Your blood pressure just goes down. So make sure try not to do it unless you're adequately rested and rehydrated. Temperature-related problems, I think I can skip that. Just make sure you have an adequate clothing prepared for you. If the condition is very bad, don't push too hard. Enjoy the walks. Make sure to prepare well. Otherwise, it becomes a torture. If you have any other medical related problems, you can email us.